or at least there was a trend towards improvement, but it was not statistically significant in his sample. However, there was an increase in red cell count, and that was statistically significant. And other studies have shown the same thing, that red blood cell content can sometimes increase. And I don't know what accounts for that, possibly shifts in the circulation and pooling effects,
Quantron
so that by increasing vasodilation, by increasing dilation of blood vessels, you actually have more blood in the circulation, and red blood cell counts can actually go up. So I don't think that this is an independent hematologic effect. It's much more likely to be a volume-related effect. And there was a pain society, an arthritis society score as well for the evaluation, objective evaluation of the distance of walking, and also physical evaluation of the knee itself. What they found is that people were actually statistically significantly, were more able to walk over longer distances as a result of the magnetic therapy. However, when you did an objective physical examination of the knee, it didn't show statistical significantly improved results, but there was a general trend towards improvement. And again, probably for kinds of physical evaluation indices that you'd be looking for, including the osteoarthritis itself, the knee, and the bone formation, or the osteophyte formation at the knee, that could take much longer periods of time to resolve. Symptoms resolve earlier than that. This study is important to me because there's another instrument out there that has been studied, and it's now available actually throughout Europe and Canada, that uses a much stronger magnetic field. And it has also, in double-blind, sham-controlled studies, shown very similar results to what we're finding here. That instrument is only available by lease in Canada and other countries. They don't sell it. It's quite expensive. You have to go to a physical therapist to have therapies. So the point that I'm making basically is that the results produced by the QRS are very comparable, and you don't have to be tied up in a physical therapy office getting treatment, regardless of the expense. So those are the two studies I wanted to share with everybody tonight that you may not have heard about. I think they're fascinating and could be very helpful for you in guiding you in how you might be able to use the QRS in addition to the things you normally do. So a quick review again of the basic physiologic actions of magnetic fields, including the QRS. We just showed that you can get significant increases in vasodilatation. As a result of that, you get increased oxygenation of tissue, you get decreased edema of tissue, and you will facilitate and improve healing as a result. You can also, because of that, improve pain. There's an independent action of magnetic fields on nerves directly, which can reduce pain. You can also improve tissue healing. You can reduce the muscle tension of any kind, so any muscle, including the smooth muscle of the vascular system, will open up, will create vasodilatation, and the muscles themselves will actually relax. So anybody who drives for long distances builds up a lot of tension, and this is why we recommend an evening treatment with the QRS, because it helps to melt away a lot of the tension that's built up during the day. There are other effects of magnetic fields, including a decrease in the fibrinogen levels. They increase what we call fibrinolysis, which means breaking down of clots, and it also decreases the stickiness of platelets. So there are two different sets of actions on the hematologic system which help you in preventing clotting. So those people who are prone to develop clots would have a decreased ability to clot. Also, around surgical interventions, like orthopedic surgery, or people laid up for a while, clotting is more of a risk. So if people treat themselves with magnetic fields before they actually go into a hospital for a procedure, they're less likely to develop clots in their legs during the hospital stay or afterwards. But also, which is really exciting to me, is the potential over a long period of time to actually decrease the development of atherosclerosis. When you have clotting going on in the vascular system, you also tend to release various other factors in the blood that can actually cause constriction of the blood vessels. This can sometimes lead to what are called silent heart attacks, or sudden heart attacks, or heart attacks in people who don't appear to have any significant risk factors. Now, if you have a smoker, diabetic, somebody hypertensive, then this is even more important. But even in young men who may have small clots or non-obstructive clots in their vascular tree, QRS can help to reduce the likelihood of a coronary event down the road. So that's the basic summary, and I guess what we can do now, Christina, is to open it up for questions.
Does the QRS actually repair and bring back to normal organs, glands, and diseases?
All right. This is a good question. So if I understand the question correctly, will the QRS restore organ function? My general response is that the QRS functions essentially at about 4 levels, or pathology or injury in the body is essentially at 4 levels. One is the energetic level. At the energetic level, the magnetic fields are just very powerful in clearing energy entrapment. So if they're at that level. The next level is what I call the physiologic level. So that's where the body is beginning to show signs or symptoms of the underlying condition. The third level is what I call the pathophysiologic level, where you have signs and symptoms, but now you're actually having the destruction of tissue, the death of tissue or the death of cells. That death can obviously at some point lead to an organ, total organ failure. Organs rarely fail all of a sudden. Usually they fail gradually over time, and usually by the time we know they have failed, they've been failing for a long, long time, silently. The fourth level is pure pathology, where the tissue is truly dead. So if you have wiped out your kidney, or you've wiped out your liver, or your heart, etc., the organ is essentially failed. If it's a critical organ, let's say if it's one kidney, you can survive because you have another kidney to back you up with. So at the energy level, the magnetic fields, let me give you an example. The example I've used before, I've used it on this call, is a cold. When you first start to feel off with a cold, you know that it's not settled in anywhere. You're not sure what's happened to you. What you will experience then is a vague sensation of malaise. At that level, the magnetic field can very quickly clear the energy in the body and restore balance. Now, it hasn't settled into a point. You don't even know at that point whether you're getting a cold or what you're getting, but you may find that with a day, it's gone in a day. Those symptoms are gone. You may never know whether you've prevented a cold. If you're not using the QRS and a cold starts to settle in, and you have a runny nose, a sore throat, some congestion, some sneezing, that's what I call the physiologic level. The QRS will take a little longer. It may take a day or 2 days to begin to demonstrate a change at the physiologic level. Once the cold progresses to a point where you have tremendous sinus congestion, you're building up fluid in the sinuses, you're coughing up some very colored stuff, you're now developing a fairly significant fever, that's what I call the pathophysiologic level. At that level, you may get a vague sense of improvement in your health. You may begin to help the symptoms over a couple of days, but it may take another 3, 4, 5 days for the underlying pathology to begin to heal. Now, once a cell is dead, the QRS is not going to revive it. But as you know, during the healing process, the body will often regrow the cells. In fact, they're regrowing all the time. The body regenerates itself about every 7 years totally. There are some tissues, and as I mentioned, the retina, the eye, the cornea, can actually regenerate tissue in 24 hours. So for regenerative purposes, if cells are struggling, if you can create a space, if you get rid of the dead cells, the body can replace that space with new healthy cells. So the QRS can help the cells that are struggling to survive to regain normal function. And then it can help to clear out the tissue by virtue of circulation and enhancing the immune system, clear out the old dead cells, and help the body to be able to replace that tissue. Once the damage has exceeded a certain point, and I can't tell you what that point is, once it's exceeded a certain point, there's no ability to recover from it.